The Social Security Administration, SSA, is facing a critical staffing crisis that is profoundly impacting its ability to serve the millions of Americans who rely on its programs. This challenge affects all service channels, but is particularly acute in local field offices, which are a lifeline for seniors and individuals with disabilities. Summary and analysis. The core issue is that the SSA is tasked with serving an ever-growing population of beneficiaries with a historically low level of full-time permanent staff. Growing demand. The number of Social Security beneficiaries has increased significantly over the past decade, driven largely by the aging baby boomer generation entering retirement and disability age. Shrinking workforce. Despite this rising demand, the SSA's staffing levels have plummeted to multi-decade lows. The agency is serving millions more people with thousands fewer employees compared to a decade ago. This reduction is compounded by high attrition rates, a large percentage of current employees eligible for retirement, and an inability to keep pace with hiring. Service deterioration. This imbalance has led to a service delivery crisis. Wait times for critical services have ballooned. The backlog of initial disability claims has soared, often leading to average wait times of many months, and call center hold times have been erratic, frustrating beneficiaries. In field offices, long queues and an appointment-focused service model mean that walk-in visitors are often turned away, or appointments require waiting over a month. Reasons and consequences. Reasons for the crisis. Chronic underfunding. For over a decade, the SSA's administrative budget has not kept pace with the growth in the beneficiary population or rising costs. Administrative funding, as a share of benefit outlays, has shrunk to historically low levels. This restricts the agency's ability to hire and retain staff, pay for overtime, or modernize its technology. Hiring freezes and staff reduction initiatives. Extended budget uncertainties, such as continuing resolutions and government shutdown threats, have triggered hiring freezes. Furthermore, recent federal workforce reduction targets have exacerbated staff losses, with many experienced employees taking buyouts or early retirement. High attrition. Overworked staff, increased job complexity as programs and regulations change, and uncompetitive compensation packages compared to the private sector and other federal agencies have driven high turnover rates, particularly among seasoned employees whose departure represents a significant loss of institutional knowledge. Consequences of the crisis. Increased financial hardship. Long delays in processing disability claims, SSDI and SSI, place applicants who are often already unable to work due to medical conditions in severe financial distress, potentially leading to poverty, housing instability, and worsening health outcomes. Reduced access for vulnerable populations. The shift toward online and phone services disproportionately hurts individuals who rely on in-person help: seniors, people with disabilities, and residents of rural or tribal communities with limited internet access or digital literacy. Office closures or reduced hours in these areas create significant transportation and time burdens. Erosion of public trust, extended wait times, denied walk-in service, and difficulty reaching a human representative erode public confidence in the SSA, a vital agency that administers benefits earned by American workers. Inaccurate payments. The high workload and loss of experienced staff can increase the risk of errors, including overpayments or underpayments, which cause major financial and administrative problems for beneficiaries. Prediction and solutions. Prediction. Without a significant sustained investment in its operating budget, the SSA will continue to struggle. The wave of baby boomer retirements will keep demand high. The agency will be forced to rely more heavily on digital and automated solutions, which will continue to improve service for digitally proficient users, but will worsen access for those who require in-person assistance. Staff morale will remain low, perpetuating high attrition. Solutions. Fully fund the SSA. Congress must provide adequate and stable funding for the SSA's operating budget. $17.39 billion is a figure recommended by some stakeholders to enable consistent hiring, staff retention, and technology modernization. Improve human capital management. The SSA needs to be more competitive in the labor market. This includes offering telework and remote work options, providing competitive pay and benefits, and investing in high-quality, continuous training to quickly onboard and retain new hires. especially in complex roles like disability examiners. Strategic service model. While modernization is necessary, the SSA must commit to maintaining a robust network of field offices, particularly in underserved communities, to ensure equitable access. This involves a balanced approach of technology improvement to handle simple tasks, and sufficient in-person staffing for complex claims and vulnerable populations. Streamline processes. Implement technology and process improvements that reduce the need for in-person visits for simple tasks, like replacement cards or address changes, while dedicating field office staff to complex claims and direct assistance for those who need it most.